Welcome to SciFlux. Here, you get daily coverage of the latest scientific research. Every day, we bring you new research in a clear and simple format so you can stay informed without wasting time. Like the video, subscribe, and leave a comment to stay connected and help this channel grow. And if you want each new research delivered directly to you, join the SciFlux newsletter. Hematopoietic cell transplantation, HCT, is a powerful treatment for severe immune disorders, but tailoring it to individual patients remains challenging. Researchers conducted comprehensive genomic sequencing on nearly 180 patients prior to HCT, uncovering primary disease causes, secondary health risks, and pharmacogenetic insights. They found that patients with more genomic risk factors, unclear diagnoses, secondary health issues, or drug response concerns experienced markedly poorer outcomes. 3-year survival dropped from 94.8% for those with no risk factors to 58.5% for patients with 2 or more. These results highlight that integrating genomic evaluations into HCT planning can significantly improve survival, guiding donor selection, medication choices, and overall personalized care, marking a major step toward precision medicine in immune disorders. Open spinal dysraphism, OSD, is a severe birth defect where the spinal cord develops exposed, causing major neurological damage even after surgery. To go beyond surgical repair, researchers investigated erythropoietin, EpoR, and its receptor as potential neuroprotective agents. In an OSD rat model, they found EpoR receptor expression was significantly elevated in critical neural development regions. They then tested EpoR on neural progenitor cells exposed to simulated amniotic fluid stress and observed that EpoR protected these cells, reduced damage, promoted survival, and restored their ability to differentiate into neurons. These findings establish EpoR as a promising candidate for neuroprotective therapy, offering a potential strategy to improve neurological outcomes in children with OSD. Pregnancy requires careful nutritional balance, and deficiencies can have severe consequences. In Borno State, Nigeria, researchers examined the impact of calcium deficiency on maternal and fetal outcomes, focusing on women also affected by hypocalcemia, eclampsia, or malaria. A retrospective cohort of 123 patient records over 5 years revealed that eclampsia carried the highest mortality risk, followed closely by hypocalcemia, which was often underreported but markedly increased maternal death risk, especially when combined with malaria. These results underscore the urgent need for free calcium supplementation, nutritional education, and early antenatal screening to improve survival rates and reduce maternal mortality, protecting both mothers and their children. Stroke patients often face dysphagia, a serious swallowing difficulty that can lead to malnutrition and death. Proper evidence-based nutrition management is vital to prevent these outcomes. In Guangxi, China, a neurology department conducted a rigorous audit and feedback project evaluating care against 9 best practice criteria. The baseline audit revealed 0 compliance in 3 critical areas and only moderate adherence elsewhere. After identifying barriers and implementing targeted interventions, a follow-up audit showed substantial improvement across nearly all criteria. This study demonstrates that systematic, evidence-based strategies can significantly enhance nutrition care for stroke patients, reducing preventable complications and improving survival. Diabetic foot ulcers pose serious risks, yet preventive behaviors remain low, increasing complications like neuropathy and poor circulation. This systematic review explored combining religiosity with the information, motivation, and behavior (IMB) model to improve prevention. Findings show that a religiosity-informed approach effectively enhances motivation for independent foot care, fostering both intrinsic and extrinsic engagement. By integrating cultural and spiritual dimensions, this strategy strengthens practical self-care skills, offering a culturally resonant pathway to reduce diabetic complications and empower patients. Sarcopenia, the progressive loss of muscle mass and strength, combined with malnutrition, drives significant health decline, especially in aging and chronically ill populations. This paper highlights the critical role of thyroid hormones, particularly T3, in regulating muscle growth, metabolism, and mitochondrial function. Both deficient and excessive thyroid levels impair muscle protein turnover, while malnutrition disrupts thyroid metabolism, reducing T3 availability and accelerating muscle loss. By integrating evidence on thyroid dysfunction, nutritional deficits, and sarcopenia, the authors propose a comprehensive model showing their deep interconnection. This underscores the need for personalized, multimodal interventions combining hormonal therapy, nutritional support, and physical strategies to prevent and mitigate muscle deterioration. Moving to the next paper, ocular mucous membrane pemphigoid, OMMP, is a rare autoimmune disease where the immune system attacks the eyes, leading to scarring and potential vision loss. Its rarity has made it challenging to define the full spectrum of ocular symptoms. This study conducted a systematic review and meta-analysis examining 35 studies with nearly 1,500 patients and over 1,000 eyes. Key findings include OMMP primarily affects individuals around 60, predominantly women, with an average diagnostic delay of 55 months. The disease is usually bilateral, with trichiasis and entropion present in up to 92% of patients, followed by symblepharon and punctate keratitis. Severe complications, such as ankyloblepharon, persistent epithelial defects, and visual impairment, were less common. Direct immunofluorescence was positive in 54% of cases, and extraocular involvement, particularly in the mouth and skin, was frequent. This comprehensive synthesis provides clinicians with a clear profile of OMMP, highlighting both common and serious manifestations. Early recognition of these signs can dramatically reduce diagnostic delays, enabling timely treatment to preserve vision. This work advances understanding of rare autoimmune ocular diseases, guiding more effective detection and intervention strategies. Moving to the next paper, ovarian cancer is the fifth most common cancer in women and the deadliest gynecologic malignancy, often diagnosed late due to nonspecific symptoms. Tumor cells frequently shed into peritoneal or pleural fluid, creating a complex patient-specific microenvironment containing malignant cells, immune cells, fibroblasts, and more. This heterogeneity underlies why standard treatments, surgery, chemotherapy, and maintenance drugs like PARP inhibitors, olaparib, niraparib, succeed for some patients but fail for others. To address this, the concept of personalized medicine has emerged. The lab introduces Zavatars, a revolutionary test designed to analyze each patient's tumor ecosystem and guide oncologists in selecting the most effective, individualized therapy. This approach moves beyond one-size-fits-all treatment, aiming to exploit the unique vulnerabilities of each ovarian cancer. Moving to the next paper, aging populations are driving a surge in long-term care (LTC) demand, requiring more personalized pathways to ensure optimal patient outcomes. This nationwide study in Portugal analyzed hospital inpatient data from 2012-2017 to identify patient clusters with higher likelihoods of discharge to LTC units. Researchers collected extensive patient information, age, sex, primary diagnosis, comorbidities, admission type, and hospital transfers, and tracked whether patients were discharged to specialized long-term and maintenance units. To refine predictions, multiple methods categorized primary diagnoses from broad ICD codes to detailed classifications, then hierarchical clustering grouped similar patients, and decision trees characterized each cluster. Out of hundreds of thousands of episodes, 4,427, 0.23%, resulted in LTC discharge. Critically, the proportion of high-risk patients varied widely depending on diagnostic categorization from 0.7% to 60.8%, demonstrating that precise, meaningful coding is far more important than quantity. These results underscore that carefully structured diagnostic data is key to predicting long-term care needs. For health systems, it informs resource allocation. For hospitals, it enables earlier, more accurate identification of patients requiring LTC, enhancing discharge planning and patient support. Thoughtfully applied clustering methods can thus serve as a powerful tool for targeting high-risk groups. Ultrasound, widely used from prenatal scans to diagnostics, interacts with the body in complex ways, with energy loss or attenuation, varying across tissues and following a frequency-dependent power law. Modeling this heterogeneous attenuation has been a major challenge, limiting accurate simulation of wave propagation in real biological systems. Full Wave 2.5 addresses this by solving the full wave equations and incorporating heterogeneous power law attenuation. Researchers can now assign distinct frequency-dependent attenuation properties to different tissues, producing simulations that accurately reflect wave amplitude, phase, and energy loss throughout complex biological structures. The practical impact is significant. In diagnostics, it enables higher resolution imaging by optimizing probe design. In therapeutic applications, such as focused ultrasound for tumor ablation or drug delivery, it allows precise modeling of energy deposition, improving both efficacy and safety. Full Wave 2.5 thus provides a robust, predictive virtual environment for exploring ultrasound interactions, optimizing devices, and testing treatment parameters before in vivo experiments, marking a major advance in medical ultrasound technology. Thanks for watching. If you enjoyed the video, please like, comment, and subscribe. Also, join our newsletter to stay informed with the latest discoveries shaping science and innovation. See you tomorrow with a new round of breakthroughs. Take care.